Hello parents, today we'll talk about hypospadias. So this is a problem with boys. What happens in baby, this is actually in baby boys. What happens is that the penis is not properly formed and it is bent, in some cases bent, very crooked, sometimes very minor bend, and the tube that gets the urine to the tip of the penis is not properly formed. So sometimes it is there just till the mid of the penis, sometimes it's there between the testis itself. So that this whole array of problems is called hypospadias, and the treatment for this is a surgery. But first, let's dive into why this happens and what problems does the child come in. So this basically happens because certain receptors on the skin, on the penis, have not really worked properly, and so the growth of the urethral plate has not taken place. So once that plate or the tube doesn't form, the penis is also gets bent and the tube does not reach the tip. So logically, what happens is, what problems does the child come with? First is cosmetically, to look at the penis it does not look normal, it looks bent, and when the baby passes urine, it does not go the normal stream how it should go. It falls between the feet, and sometimes it falls with like a drip drop wise, and sometimes the child might also get UTIs or urinary tract infections. Any of these presentations are possible. Sometimes the child might also have a block and a problem in passing urine itself. So when all of this, if you feel the child is having all these problems, then baby could be having a hypospadias. Now why correct it? Firstly, to allay all these symptoms, and secondly, most importantly, for the function. So the penis, firstly, the function is of fertility, and for that the tube has to come to near the tip, at least if not the tip of the penis. And the secondly is obviously cosmetic. The child will grow up and will understand obviously later on, this is the penis and mine is not normal, and that could actually affect the child later on. The surgery or the treatment of this is a surgery which is called the urethroplasty or hypospadias repair. This is a very complex surgery and can require 2 stages, if not 1 stage. Now what happens is, basically then this what we do is, first we straighten the penis and make sure there is nothing attaching or holding the penis to a curve, so that later on when the child grows and the penile length also grows, so the penis stays straight. That is the first part of the surgery. The second part is creating a tube, the urethral tube, wherever it was, till wherever it had reached, from there till the tip or till near the tip, so that the functions of the penis can be performed. Now this urethroplasty procedure, because it's a very very delicate procedure, very long procedure, after this surgery there's a tube kept inside the urethra like a catheter for about 7 to 10 days. First the dressing is removed, and then later the tube itself is removed, and once the tube is removed, then we see how the stream is and how the child is recovering from it. So during the surgery, obviously it being a long complex surgery, there can be some time taken, and even after the procedure you might have to stay in the hospital for about 2 to 3 days, but then after that the patient is normally discharged to home with the catheter in situ, and on follow-up the dressing is removed and the catheter is removed. If the child requires a surgery, a stage surgery, then the second surgery is done after 6 months of the first surgery. Now when to get the surgery done? So ideally after the first birthday, that's the best time, because the tissues are supple and the hormone levels are perfect. So that is the right moment to do the first stage or the stage of the repair. So if the child requires only 1 surgery, then after the first birthday child can have the surgery. If requires 2 stages, then everything finishes before the child starts going to play school and anything. So once the surgery is done, after that the child requires a follow-up for how the growth is coming and how the stream is of the child. So might have to come in yearly once to show how the growth is of the child. Now hypospadias repair per se is as I told you, it's a very delicate repair. So the first time done hypospadias repair is the best procedure, best repair that can be done on the child. So it has to be done very perfectly, because the moment it fails, then redo hypospadias repair has as a redo happens, the success rate of the surgery drops. So the first surgery done in this regard has to be done by a specialist, and hence it's very important that a hypospadias repair is done in trained hands. Thank you.